So please join me in welcoming our speaker, Kira Reginata.
Thank you. I have an unusual opening. How many of you know this song? Who are the people in your neighborhood, in your neighborhood, in your neighborhood? Well, the reason I was thinking about that is that I'm in the neighborhood, but nobody knows what an elder care manager is. And chances are pretty good that you're going to actually need one, because every time I go to a party and tell anybody what I do, that it has to do with looking after somebody who is over 65, I am consulting the entire party. So I know that people need the services, but they don't know what they are. You guys have your dentist as part of your professional team, and a physician, and your financial planner, and an attorney. But if it comes to elder care questions, you don't know where to go. So I'm hoping by the end of today that you look at me as somebody in the neighborhood whom you can call. And if I don't have the answer, or I'm not local, I will find an elder care manager for you in your area. So what is an elder care manager? That's usually what I get asked. And it's also known as a geriatric care manager. If I don't want to talk to the person at the party, that's what I say that I am, because then they go, well, what? And they just take their drink and they keep walking. But if I use the word elder, they usually stay. Typically, a geriatric care manager is someone who's a gerontologist, as I am, who has studied older adults and worked with them. You'll find a lot of elder care managers are nurses, or they're licensed clinical social workers. And in fact, as of today, we don't have a standard in the profession. So there are actually a lot of people that say they're elder care managers and can say, because we don't really have like a per se licensing yet, but that may be coming down the pike. So I do two things, as I mentioned. I'm an elder care manager, and I also do the radio show, because my passion is to get this information out to as many people as I possibly can. And when I'm doing my private consulting, I'm just helping one family at a time. How I usually work is, or how all of the elder care managers work, is that we have the ability to do a one-time consultation with you. So you can come in, let us know what's going on with you, and we can give you some resources. Oftentimes, I'm helping by doing a family meeting, so maybe I'll meet with the brothers and the sisters first. I'll talk with them about what's going on, and then I'll maybe meet with mom and dad separately, so we have the ability to do that. Typically, I'm called in for a lot of crisis management. My mom is in the hospital. They're telling us she needs to go to a nursing home tomorrow. My mom doesn't want to go to a nursing home. Help! What do we do? So I'm often meeting people bedside in sort of crisis situations. I also do what we call ongoing care management, so that I'm meeting a family at one point in time, helping them through something, and they may call me 6 months later, they may call me a year later. I may meet with someone and end up working with them for the rest of their lives, which I really love doing. It just makes when they leave a little difficult part of the job. And the way we start in our profession is we do an assessment. We call it an in-home assessment. That's how we do our magic. We start by seeing the person in their house. We use all of our senses when they're in the house, including our nose in terms of how they're caring for themselves and their pet. And usually we do a written report. We give some resources. We advocate and we monitor. And that's sort of it in a nutshell, but what I thought would be fun to do tonight is to actually tell you stories about how I do all of what I do all day and how other elder care managers do. So, a lot of the children that I meet are nervous about approaching mom and dad. They are the head of the family. And I don't care if you're a neurosurgeon or you're the head of the Commonwealth Club, you are still their kid, and you ain't going to tell them what to do. Enter geriatric care manager, professional, trained, know how to get in there and start working with people. I have much more purchase. So that's part of my secret to success, is that I'm not family. And I'm also not afraid to have those hard conversations. A lot of people say, Dad shouldn't be driving. You tell him. I will have that hard conversation. I'm okay with that. My dad is here today, and I'm proud to say I have not had to have that conversation with him yet. But I'll tell you, I always ask my clients, regardless of age, regardless of their mental status in terms of dementia, because I do deal with a lot of people in their very late 80s and their early 90s, a lot of people who have memory loss, what are your goals? How do you want to age? And I just interviewed a woman who was listed as having severe dementia. You tell me if this sounds like severe dementia to you. She's 92. She had to move into an assisted living facility, and she wanted to go back to her house. And she was sort of trying to figure out with her family if that was going to be doable, and I was called in to consult. And her quote is, I said, "What's your goal?" And she said, "To make a difference in this world before I leave." Doesn't get any more profound than that, right? Just because she's 92, I'm not writing her off. She still has goals. She's able to articulate them. So I always ask people, you know, how do you want to age? What do you want? How can I make that happen? This isn't an us and them. This is a team approach. And a lot of times the adult children are trying to sway me. This is what I think should happen for mom or mom and dad. And they push and they push and they push and they push on their agenda. And they're actually footing the bill a lot of times for my services, but that's just tough darts, because the person I'm really listening to, unless there's a move for conservatorship or the person is very, very mentally ill, is what does the senior want to do? And how do I work with them? And then how do I marry both of those and have the whole family sort of be healthier? So identities are changed here. These are sort of vignettes and stories that I think will be helpful. I call it the M's, and you saw that on the advertisement for the show. I look when I go in to assess about whether or not somebody should move or stay put. Usually that's my number one call, is people call me saying, "I don't think my mom is safe to stay anymore by herself. I have some concerns. We think she should move now." That's not always the answer, but I'm called in to look at that. I look at memory. I look at someone's mobility, and that's not necessarily their ability to drive or take public transportation, but it also may mean how they're ambulating in their house. We have what we call furniture walkers. So the person has a lot of pain and they're waiting to get to something that they can hold on to and then to the next surface that they can walk to. So we look at improving that sort of mobility even in the house as well. I'm assessing medications, the importance of people knowing what they're taking. Older bodies do not metabolize medication the same as somebody my age. Their kidneys aren't excreting it, their liver's not processing it, they've got other medications on board, so there's med-med interactions. And they may not be taking the meds the way they were designed to be taken. I did have a client the other day who said, "I'm not supposed to eat grapefruit with this." I read that little drug scare sheet. I said, "My God, you're absolutely right. This is one of them that doesn't have grapefruit." Now, this man could not remember when to take his meds, but he knew not to have grapefruit juice with them. So I look at their medical condition. A lot of people don't need me in their 70s because they're doing really very well and even into their early 80s. But as different medical conditions come up that start to add together, we get condition after condition after condition, that's when they're probably needing more support. And I'm called in at that juncture to start to do an assessment. I also look at meals, and that might mean not only what they're eating, but what they're hydrating themselves with. I have a lot of adults that use alcohol and don't drink a lot of water. I have a lot of people who do a very minimal amount of eating and then take a lot of medication. So I'm looking at how they're preparing meals, what they're eating, what they're drinking. I look at their teeth and their dentition, how, what kind of dental care have they been getting. And a lot of my families will say, well, they're 85, we don't want to spend any more money on dental care. So it's my job to sort of bring my arms around all of that when I'm doing my assessment to get a full picture. I'm looking at mood, another M. A lot of my clients are depressed. A lot of the men get depressed after retirement, and I'm meeting them 10 or 15, 20 years down the road. They have not found anything else to do with their time. Their spouses, their significant others are pretty discouraged. Why don't you do this? Why don't you do that? Why don't you do that? Well, that person might actually be clinically depressed by the time I'm assessing them. I also see a lot of anxiety with my clients. I have a lot of people that have had a history of mental health illnesses that I'm looking after. So we'll talk about that M. And then money. How is somebody handling money? I'm going to have a wonderful woman on my radio show who's an attorney, and she talked about the gray zone of when your parents aren't quite writing their checks correctly, they're paying things late, they're paying things 3 times. They don't have any sort of dementia diagnosis, but we're starting to think that that financial cloudiness is actually one of the precursors of some mild cognitive impairment and one of those red flags that we really should be paying more attention to. And then lastly is legal, because legal doesn't start with an M, so I had to make it legal, Dad. Yeah. I couldn't think of an an M for legal, but basically that is getting your paperwork in order. What do you want for someone if they can't handle your finance? If you can't handle your finances, who's going to do so in your stead? My daughter, who's here today, is actually my power of attorney. If I were hit by a bus by Muni, which you know is very likely in this neighborhood, my daughter legally could sign on my business account, and she legally could sign on my personal account. There's not much money in there, but probably, for 2 or 3 months, we would be okay. And then an advanced healthcare directive. I worked for hospice. I don't know what's going to happen to me, but if it gets to a point, I already have my wishes written down. I have a hospice nurse who's my agent, and I have a backup who's my mom, who said, I hope I never have to be your agent. I don't want to have to make those decisions. But we're talking about legal, getting your affairs in order in terms of your final paperwork for the future. And then, of course, a will or a trust. So that's the M for legal.